Everyone, it's the big day. Oh my god, I don't know if this is just, it's been a long time since I vlogged. Today is the big day. It's the day of going to the dentist, and today is Monday the 10th of March. I'm very nervous because it's been quite a while. My hair is not cooperating today, so I apologize for that. And I am wearing this because I'm doing a photo shoot today. This is really, oh, there we go. So, and I'm wearing these sneakers because I'm going to be doing some walking. I do have a change of clothes. But today's the big day, guys. Wish me luck. It's in a couple of hours. So, well, not a couple, more like an hour and a half. I gotta leave here like pretty soon. Wearing my cross because God is with me. And yeah. Pray that I don't have too much work I have to get done, because that's gonna cost me a lot of money, and I don't know. I hope people enjoy this vlog, and I hope I can vlog it. So anyways, see you all in a bit. Praise.
Exactly. Have you live in the area here?
I live in Rosemount, but I'm not far, so.
How did you end up finding us?
My best friend.
Oh, cool.
Yeah.
She obviously comes here then?
Yes.
Okay.
Yes, she does.
Good.
She has insurance, though. I don't.
It makes it challenging, doesn't it?
Yeah, I was like, this is a really hard decision. But you guys know stuff about TMJ, so I trust you.
Well, let's start fresh and get our information, and then we can go from there.
Yeah.
How long ago was it that you started assisting school?
That was years ago.
Okay. Probably pretty close out of high school or something?
Yeah.
Okay.
Well, I went to college when I was in high school, so.
Okay. Well, perfect. That's super smart.
It's better. I mean, you could get away from the high school kids.
Yeah, exactly. Just be done with it.
Yeah.
All right.
I have a very tiny mouth.
Sounds good. Very familiar. All right, rest your head back. See if that's okay.
Oh, that's better.
Okay, good. That way I'm not pushing you around.
There you go.
Give you a little control. We're going to start on the right side here.
Okay.
Excellent. Then gently bite together. Excellent. And we're going to move forward and then bite together. Excellent. Good job. All right. Sorry about that. Now, do you remember since you've had some gum? Did they do a deeper cleaning?
I haven't had one.
Nothing like that.
No,
it was suggested.
The last dentist was kind of off.
Okay.
So, like, they said my gums were bleeding really bad, and they didn't do anything about it.
Okay.
So,
did they want to schedule you to come back and get your teeth cleaned?
they're gone.
Oh, okay.
They disappeared.
Well, it might make sense then.
Yeah.
And gently bite together again. All right. And open. One more. Excuse me. And bite together.
Ugh,
I know, right?
so big.
It is. Well, we got what we needed, so that's good. All right. So what I'm going to do next here is I'm going to step up for just a moment here. I'm going to go set up the other one.
Okay.
With this one, though, I'd like to have as much like jewelry off. Do you have earrings in?
No, I don't have
just a necklace.
Just a necklace.
Okay,
Yeah.
and when I can help you take that off if you'd like.
Yeah. Yeah.
So I'll be right back. I'll help you take the necklace off, and then we'll get that in. Just palm up, just like that.
Oh, you guys do the wrist ones. Thank you, God.
Yes, right? Nobody wants to be undressing with us.
No.
But yeah, and then you're just going to relax your hand just
Okay.
like that. I know they're all made just a
They're
little bit
weird.
differently. This one will take about 20 seconds as well.
I also get food stuck in my teeth.
Yeah.
In the front.
Okay.
Like a lot.
And have you tried just using regular dental floss?
Oh, yeah. That's what I use.
Instead of the threaders?
Yeah.
Yeah. I know, it's such a pain.
Oh, these retainers are a pain.
Yes.
I broke my lower retainer twice.
Okay. So you had ortho then. Fantastic.
I've had lower jaw surgery, so.
You did? Is that what I'm seeing on those images?
Yeah,
All
you're
right.
probably seeing my screws.
How long ago did you have that?
God, that was 214, I think.
Oh, okay. So about 10 years ago.
Yeah.
Nothing that I see that's really concerning.
Well, that's good.
All right, I'm gonna step out. I'm gonna chat with him.
All right.
He just finished up across the hall, so it'll be just a few minutes, and then we'll continue on and on.
Awesome. Sorry, guys. These chairs are so comfy. Oh, my jaw is hurting again.
Do you clench or?
I don't know if I do.
Okay. Are your teeth touching?
No.
Okay. So when you're just in a casual, relaxed position, are
Yep.
your teeth apart?
Well, I also have fibromyalgia.
Yep.
So that affects my jaw, apparently.
Yeah.
I learned that this year.
Absolutely. Yeah.
I was just like, you've got to be kidding me.
Hello.
Hi.
I'm Brandon.
I'm Elena.
Nice to meet you.
I have a lot of medical stuff.
Yeah, no problem. Jenny, we kind of reviewed most of it with me. I just have a couple questions.
Okay.
Get your...
A lot of my medicines dry me out. Just,
Sure.
yeah.
So you were on 3 different... so you have 2.5. You have 2 albuterols.
Yeah.
And then you have Symbicort, and then you have a...
Symbicort is going to be changing for one of my inhalers.
Okay.
That's just changing this year. But we have to wait till my insurance goes through first.
Got it.
So
And then you take... never mind, that's Zyrtec, okay.
it's a lot.
So when you're on that many asthma medication, that makes me concerned. You have a lot of attacks. Okay. And are they emergency attacks?
Yeah.
You have to go to the ER when they happen?
No. I have a twice a day inhaler to help with that. I try not to go to the ER because there's too much COVID and stuff, and I'm chronically ill, so it's more dangerous for me to go to the ER than try to do a nebulizer treatment. So, yeah, I'm on a lot of asthma medications.
Does anything that happens at a dental office exacerbate it? Do you know what can cause it? Just...
Being sick, that will definitely do it. Sinuses, colds, anxiety.
Do you have them every day in an attack?
No.
How many
No.
times a month do you have an attack?
God. Well, it depends on, like, I'm really allergic to dust, and there's a lot of dust in my apartment. So, and it's really hard to keep clean because I'm so allergic. And we realized that dust is probably making me have more asthma attacks because I wasn't able to breathe this year very well. Like, I went 3 days without my inhaler, and I couldn't breathe by 3rd day. Yeah, I've been having asthma issues since I was a kid.
Sure. Okay.
But it's gotten worse since I've gotten older. And I got a cough, like, I think 2 years ago that would not go away, and it was affecting my lungs. So
Okay.
I still hear it in my... I heard it last night. So.
There's some crackling or grating, yeah.
Yeah.
Oh, there's another asthma medication too. And then migraines. Okay, and then a sleep med. Do you take anything for your ADHD?
No, we don't. No,
Okay.
because I'm not working.
And then on some of the documents it said that there might be some cognitive impairment.
Yes.
Do you have anybody help you with making decisions or driving?
My mom and dad.
Okay.
So, yeah.
So as far as your medical care, if we were to say you had 2 cavities, is there another person we need to talk to about that?
No.
Or you're able to make those decisions?
No, I can make those decisions.
Okay.
My parents are in their 70s now, so it's about
Yeah.
time I...
Yeah, okay. But you drive yourself, take care of everything else yourself?
I lift. I do not drive.
Okay. So
You lift? Okay, you take
Yeah.
that, okay, like
Yeah.
an Uber, okay.
Yeah.
Okay.
Yeah, I can't drive.
Do you live by yourself then, or live
Yes,
with,
I
okay.
do live by myself.
And then it says also, so the breathing problem, the asthma, allergies kind of all fit together. When do you get your headaches?
All the time.
So you just have...
I get constant migraines right here. Sometimes on
behind your
this side. Yeah.
Okay. And then with the jaw pain,
That's all the time.
did you ever have a night guard made or any treatment
I
for it?
did have a night guard made years ago, and it gave me more of a migraine. So
Sometimes if they're not adjusted right, so we make them to be real even and make it so that you move on it in a particular way. And
Okay.
sometimes if it's not adjusted ideally, it can make things worse for sure. Did you see a specialist for that?
for TMJ,
Yeah.
no.
Like go to like the Minnesota Head Neck Pain Clinic or anything like that? Just a general dentist?
Yeah.
Okay. Okay. So this med list looks like it's updated as of the 17th.
Yep.
So we're good to go
Yep.
there. Okay.
So I give you the updated version.
Perfect. Well, that's very helpful.
It's like, I can't write on your paper. It's too little. I have to print these out for you.
Yeah.
Okay. Yep, I think we have a kind of a complete list there. Okay. So today we're going to just look at everything and
Okay.
then talk about what we find and concerns and different things. So.
Well, I know I've been suffering from gum disease my whole life.
Oh, it looks like you had, yeah, Jenny told me you had a jaw surgery.
Not fun. I would not recommend.
No. All right. So.
It made my jaw worse.
I'm going to hand you some sunglasses here so you can flip those
See?
over. It will help protect your eyes from the brightness.
Yay.
And I'll have you lift your head up here. I'm going to adjust this too to make.
To make me fit.
Yeah.
Do you want me to move back forward?
How does that feel? Does that feel okay?
Yeah, that feels fine.
Okay, good.
Do you have any pain with those lower right back teeth?
I've had pain with this one, the first one, but I think there's a cavity under my crown.
So the very back one
Yeah.
bothers you?
Yeah. No, the first one does.
The one in front of it? Okay.
Yeah. The gum's been hurting for months.
The gums are, so when you brush or you floss, it hurts? Okay.
Yeah. And I just noticed something black under my crown. I was like, that wasn't there before. I was like, uh-oh.
Sometimes it can just be a piece of debris or stain too.
Oh, okay.
Doesn't always mean it's bad.
The back molar up here, though, that one was hurting me for a while, and then it stopped.
Okay. All right, let's take a look at everything. So, and you bring your inhalers with you everywhere you go?
Yes.
Good. So let's say of the last 50 attacks you've had, have any of them resulted in you needing to go to the hospital?
No,
So
that
you
was...
manage it pretty well.
Yeah, I manage it.
And can you sense when they're coming on?
Yes.
Okay,
Yes,
good.
definitely. Especially when it's really, really cold outside. Yeah, you can't breathe in that 20 below.
Yeah.
No, definitely not.
So I'm going to start by just looking at the gum tissue and the soft tissue, your tongue, your palate,
Okay.
your lips. Go ahead and have you open, stick your tongue out of your mouth. Bite together. So class 1 bite. And yeah, Jenny, so they were missing one set of bicuspids.
Okay.
And I would guess that they are, on the bottom, they look like the first bicuspids that are here. So second's on the bottom.
Okay.
On the top, it's harder to tell. Top, it doesn't matter which one you pick. So I would just change that to these two that are missing. You can leave the top ones. Okay. Open wide. Bite together. Open wide again. Big as you can. Is that as big as you go? Okay. How about going left to right? Can you wiggle your jaw back and forth?
It hurts.
When you move it, it hurts? Okay. And where does it hurt?
There.
Okay, I'm going to try to, what I want to differentiate is whether it's muscle pain or if it's the problem inside the joint pain, okay?
Okay.
So I'm going to have you take your chin
Okay.
and push into my hand to the right. Just move so what you want to do is you want to move your chin right. I don't want you to move your whole head.
Okay.
I just want you to push your chin into my hand.
Okay.
Go ahead.
I am.
So let's take a step back. I
Okay.
want you to just wiggle your jaw left and right, okay? There you go, just like that. Do it again. It's easier if you close more.
Okay.
Now do it. So, yep. How about the other way? So there you went straight. So are you able to move your lower teeth to the right side over
I
here?
can try.
Yeah. There you go. Now go to the left. And just try to relax everything here, okay? Go ahead and push to the right. Go to the right. Can you move your teeth to the right? There you go. If I do that, does it hurt up there?
Yeah,
Okay.
a little bit.
Let's try it a different way here. So I want you to just, I'm going to wiggle your jaw.
Okay.
I don't want you to fight me or help me. I just want you to kind of let me take control.
Okay.
So I want you to try to release all the tension, okay?
Okay.
And just relax your jaw. Yeah, you're pretty tight.
Always been.
Yeah.
I get severe earaches.
How about here? Is this tender?
Oh, it's always tender.
Yeah.
That's where I get the migraines.
Okay. So I would probably say for the TMD, we'd want to work with a specialist on that.
I thought you might say that.
Well, the reason for it is I'm having a hard time, and it's not your fault. It's nobody's fault. You have a hard time moving your jaw, so it's hard for me to even discern what the problem is.
Okay.
It definitely seems like you have muscle tension.
Okay.
Which, if you look at 90+% of the time when people say they have TMJ, it means that they have tight muscles, and the muscles are overworking, they're clenching, they're fatigued, and a lot of temporal headaches, which is in this region,
Yeah.
are caused because your temporalis muscles up here, it goes down and connects to the lower jaw, and when you clench, it squeezes that muscle. So ultimately, we'd want to try to help you release the muscles,
Okay.
and the night guard can help with that. One thing we can try to do is I'm going to have you stick your tongue to the roof of your mouth, and then as far back on the roof of your mouth as it goes. So try to stick it back by your throat there. There you go. See, now that'll seat the jaw. And what I want you to do is just slowly bring your teeth together. Keep your tongue up and back. Yep, and just kind of rotate closed. And tell me which tooth hits first. And keep going until a tooth hits. You know which tooth hits first? All the way in the back, or is it in the, okay.
In the front.
So like right here? Okay. Okay. All right, now I'm going to look specifically at your teeth, okay? We're
Okay.
going to go tooth by tooth. I'm going to tell Jenny what I'm seeing. And so anything that's present, and then anything that I'm seeing that's new or needs help.
Okay.
So tooth number 2 has a DO composite. And an MO composite. And then 3 has an MO composite. 4 has a DO composite. Seven has a distal facial composite. The bonded retainer from 7 to 10. Sure, actually, that would be helpful. All right, 12 has a DL, 14 has an MO. Uh, 14 is actually an MOL. As is 15. Okay, and then we'll move to the bottom. 18 has an occlusal composite. 19, I think you have the crowns and the root canals. And then, so that's first percussive. We have a DO on, yeah, okay, you got that. We have a bonded retainer on the bottom. Turn to the right for me, towards me actually, perfect. Yep, sorry. Just a little bit of an inflamed gum tissue.
So around 31.
30 and 31, yeah. And then what you're seeing, that dark you're seeing down here, is just a little stain.
Okay.
So what happens oftentimes, ideally we want that crown edge to be tucked right under the gum tissue so you can't see it.
Okay.
It's a little bit above your gum tissue, and there's just the tiniest little seam between the crown and the prep tooth where stain is accumulating.
Okay.
And so what you're seeing the crown there, you're seeing a little sliver of tooth, and then you're seeing your gum tissue.
Oh, wow.
So that's what you're seeing, which is totally normal. We see it all day, every day, because as you get older, your gums will recede a little bit. It's part of an aging process.
That's been happening for a long time.
So I would tell you though, overall, your mouth is, other than those areas where the gums are not so happy, which is, we just call it gingivitis, which is
Right.
Totally reversible. Okay, I would say you're in pretty good shape. I'm going to go do an exam. I'd like you to take a PA of 30, 31, just to get a closer look there. And then we'll come back and chat some more, okay?
Okay.
All right, Emily, I'm going to sit you up here.
Oh, boy.
There we go.
Here we go.
I'm just going to take one more image there of that lower right so you can get a more precise information on the roots.
Okay. Oh, darn burns, though. It's kind of dying, so.
Is it? Is it not that great anymore?
It's not that great anymore. There's not good any restaurants anymore. Yeah, everything is kind of gone.
That's too bad. I love the location of Burnsville.
I know. They're bringing Chi-Chi's back, though.
Yeah, are they bringing it to Burnsville?
I don't know.
I did hear that.
Yeah, I heard it too. My mom and dad told me. I was like, yes. Same.
Yeah.
Yeah, I grew up to it.
Where did you grow up?
In Minnesota, Burnsville. Yeah.
Yeah. Oh, right. Was there a Chi-Chi's over there?
Yeah.
I did not know that.
Yeah.
I tell you.
It used to be where a bank was.
Okay. I guess when I was younger, I didn't realize there were
Several of them. Oh yeah.
All right. I know you love the stretch.
Uh-huh.
Let me bring you up just a bit here. There we go.
Lovely.
I know. This is a different angle, too. Open one more time. There you go. And then gently bite together. Perfect. Thank you. Thank you. Chin up a bit. Excellent. Thank you. Thanks. Fantastic.
That actually hurt my tooth to bite down.
Did it? Is
Uh,
it typical for pressure?
No.
No, okay.
Then again, I'm guessing
You
my
tend
gums.
to, you avoid that side for chewing?
Yeah.
Yeah.
Sometimes I only chew on one side, and I'm like, oh yeah, I do that a lot. Right on down.
Do a little tapping on these teeth here. I just want you to lift a hand up. I'm going to start more towards the front and work my way back.
Okay.
And if anything's different or anything like that, please just lift a hand up.
Okay.
Usually I can tell by body language, but. Is that all okay?
Yeah. Oh, that's a little sensitive.
That one is? Is that one too? No. Excuse me if I get your tissue. That's okay? That's not. Okay. One more time, big open. That a little bit too? Yeah, that too. Okay.
Those are old root canals.
Yeah. Well, we don't want you to have pain.
No, I really don't want to be in pain. I'm in pain every day.
Yeah, you don't need the extra. No extra on things. I'm just gonna floss down there.
Oh.
Tender. Sorry. Oh, it's pretty decent, but they're tight. That's for sure.
Ow.
Okay.
Oh, that's good tasting floss.
Is you being sarcastic?
No, I'm not. It's good.
Okay. It's a Listerine.
Oh,
Yeah.
interesting.
Yeah. That's what I use at home. I really
I
like
floss in the shower.
Oh,
Because then I remember, and then you taste it better.
That's awesome. I've not heard that. That's actually really smart, actually.
Yeah.
You easily swish and remove the debris.
I try.
Yeah.
There's no mirror in my shower. I need to get
You
one.
gotta add one.
Yeah. Mom's like, why do you take such long showers? I'm like, because I'm flossing.
That is hilarious. I do have that. All right, let's grab one item here. I'll be right back.
Yeah, I don't know how good my gums are right now.
Okay.
I have no idea that they're. We're getting a cleaning today. Whoa. Time to
So
look
I
at
did
these.
just percussion tests on both of those.
Yeah.
And on the buckles, they seem to be okay, but on the occlusal surfaces, they were both hypersensitive.
Yeah, and I think part of it could be the bite.
Great.
Yeah.
You want to bite?
Let me just look at the bite. There's a little darkness around 31, probably not enough to make me super worried about it. When I look at this root canal,
Okay.
it's a little short. And what I mean by short is, well, one, so these canals that you see this white streak, that was the canal, now it's filled. I don't know where this canal comes out. Sometimes it comes out the side, sometimes it comes out here.
Right.
These to me just look like whenever we do a root canal, so I'm not saying that's it was done poorly. Sometimes it's the way it goes.
He was an old man.
Yeah.
So.
Well, and sometimes it's the way it goes. I try not to be critical because doing a really good molar root canal is hard.
It is.
And so when I look at this,
These both had infections.
yes, and they're a little short to the point where if this was symptomatic, it would make sense to have it evaluated and maybe retreated. Okay, but that's to determine. Okay, is it within the scope of it's okay?
I mean, that tooth has been hurting me for a long time.
The very back one?
Yeah, let me
No, the first one.
the second one in.
Yeah.
This one.
Okay.
That one looks really good. So this is
Yeah.
your back one.
Yeah.
This is your midline. This is your back one.
Okay.
So the one you're worried about is actually looks better than the other one. What we'll do is we'll have the perio assessment done with hygiene for a profi.
Okay.
I think she'll enjoy that more than probing.
Okay, sounds good. All right, we're gonna check your bite, okay?
Okay.
I'll have you open just like that and bite together. Tap, 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 tap. Nice and firm, up and down, just like
And
that.
grind into those back teeth.
There we go.
And open big. Bite together, grind. Boy, it doesn't seem too bad. You're definitely hitting there, and you're hitting a little bit on the incline. I could adjust that a little bit for you to improve that, and that might make it feel better, especially for people that are real big clenchers. They teeth, so
I probably do clench.
well, it's part of that TMJ stuff. that
Oh,
we
is
talked
it?
about. Yeah,
Oh my
yeah.
god. So I am clenching. Dang it.
I don't, and part of the reason why I want to refer you is I want to make sure the diagnosis is correct. Because without me being able to communicate well with you to get the jaw to do what I need to do, it's hard for me to determine what's going on.
Right.
Because if it's jaw joint pain, like in the joint,
Yeah.
that's one thing. We do certain procedures for that. If it's muscle, we do something else.
Okay.
And unfortunately, there's a muscle right here that goes from the condyle. So your jaw goes up here.
Right.
From that condyle to the upper jaw.
Okay.
And that's what pulls the condyle forward for you to open. So you can have pain in that muscle, which can mimic exactly kind of in the same location of your ear.
Oh my god.
So that's what's hard to differentiate sometimes.
Well, I had my ears checked, and they said there was no infection in my ears.
Different thing.
Right.
Totally different thing. So the jaw joint sits close by your ear.
Okay.
So a lot of these things can mimic each other. But the joint capsule, so where your jaw goes up into the skull, there's a capsule there.
Oh wow.
It's a joint, just like your knee joint, just like your elbow
Right.
joint, and then your ear, the tube for your ear doesn't go into that space, so it's a little different. So if
Wow.
you have sinus infections or ear aches, that'd be more like the cold and flu category
Right.
kind of stuff. Yeah, fluid in your ear. So you shouldn't have any sensitivity because these teeth have had root canals.
Right.
A little bit of water here, though.
All right.
Bite together, tap, 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 crunch, 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 and grind, and open. That looks better.
That was new verbiage.
Crunch, crunch, crunch.
You haven't used that one.
I don't know if I've ever used
I
that.
don't think you have. The ta-ta-ta one, yeah.
Oh, I love the ta-ta-ta.
Yes, you do.
And bite. Tap, 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 tap. Grind, grind, grind. Open. Yeah. Does that feel different to your bite?
Yeah.
So I didn't really change anything other than I took the bite on the teeth where I didn't want it. So your molar, when you on the lower molars, we want you either biting on the cheek side cusp tips or the flat spots in between the cusps. Not from between the cusp tip and the floor.
Right.
That's the incline. You're hitting on the incline of that tooth, which puts a little lateral force on the tooth.
Oh, wow.
Teeth don't like that.
Oh, okay.
So the back teeth are only meant for engaging up and down.
Right.
Well, that's not true, but from a standpoint of like, if we're looking at the perfect bite and how things fit well together and have a peaceful existence,
Right.
we don't want you hitting on the inclines of those back teeth because it's really hard on them.
Right.
Okay? So what I would do is I wouldn't do anything else,
Okay.
and I would just see how that feels.
Okay.
Ultimately, what I want to do is get you to feel better, move you in a better direction.
Right.
The barring something wrong inside your joint, getting the muscles to relax.
That's
can be
hard
an
because of my
ongoing
fibro.
process. Yeah. So, the specialists are going to they're going to have more tools in their toolkit to help you.
Okay.
Yeah, and what I would tell you, the really good news is I don't have any dentistry to recommend for you. Okay, all I have is hygiene, which I think you're doing fine. You have now. I can't diagnose gingivitis, periodontitis because I haven't done the probing.
Right.
The hygiene. I wish I could say I was really good at it. The hygienists do it every day, all day long, and they're
Right.
the experience is going to be more gentle with them than if I do it. So,
Okay.
already just the way you didn't enjoy me exploring around those crowns on there, you got a few areas where the gum tissues are red, not everywhere.
Yeah.
So gingivitis is when we have inflamed gum tissue without bone loss.
Right.
Periodontitis is when we have the bone loss,
Right.
and that's when we're more concerned. Let's just look at the panoramic together.
Okay.
And then I'm going to publish that name too. So when I look at your panoramic x-ray, just from a two-dimensional standpoint, your bone levels look quite good. So
Thank God.
I'm gonna have them do the perio assessment and then likely complete the cleaning, barring no surprises. And then I'd like to just chat with you to see how things are feeling. I do think
So I don't have any cavities?
it does not appear so, no.
Okay.
And even
Did you
though
say that you were using Clinpro or Prevident or something like that, a higher fluoride?
Yes.
Okay.
I think it's
yeah,
Prevalent.
and so with the amount of medications you're on, dry mouth, saliva acts to basically create a threshold where you have to have quite a bigger attack before cavities show up. When we lose saliva, that the defenses just aren't as strong, so
Right.
cavities can show up quickly. Now, when I look at your mouth, there's two categories for dry mouth. There's I can sense my mouth is dry, I don't feel like I have a ton of saliva, and then the next category is people their mouth is like Velcro because they have no saliva. I mean,
Right.
almost none. You're not in that category. You
Thank
still
God.
have some flow there. That next category, I've only seen 2 or 3 people with it in 15 years.
Oh, wow.
Is scary because it can. One lady lost all her teeth
Oh,
because of
God.
it, and because I don't know if she was also taking the best care of herself.
Mm-hmm.
But you're fighting an uphill battle when we start to not have saliva. Okay?
Right.
So I'm just going to smooth that spot on your
Okay.
lower right molar. And the one other thing, sometimes when it hurts to do something with hygiene, we stop going to the area because we think we're doing something wrong. It's actually quite the opposite.
Yeah.
When things get inflamed, the only way to improve it is to get in there and clean it and, get the debris out of there. So we do encourage,
Help stimulate
brushing 2 times a day for 2 minutes.
Yeah.
And then flossing at least once, and I usually recommend before you brush at night, but you can, whenever you do, it's fine. And then, go in between the teeth and wrap the floss around the side of the tooth as much as possible to cover as much surface.
Yeah.
Go down into the gum tissue until you meet resistance, and then do the other side.
Okay.
And what you'll notice is, at first things are going to bleed a lot, sore spots, and
Yeah.
then you're going to notice over time just slowly those numbers, the amount of spots that cause you problems gets less and less.
Okay.
Okay? And then I want to compliment you, because what I perceive is that you kind of maybe aren't your own best friend. Meaning you might be harder on yourself and maybe don't feel like your teeth are really good, etc. You have, I'm assuming your premolars were removed for ortho. You have all your teeth still, and they're in pretty good shape.
Yes.
So you're doing pretty good.
That's good.
A lot of people would love to be in your situation.